Let's insert an NG tube. First, we want to make sure our suction is set up and working. Then we want to set up our supplies. Remember, this is not a sterile procedure. You want to keep an emesis basin and tissues nearby just in case the patient vomits. Then we want to make sure our patient is in the proper position. This is having our patient sit in an upright position. Then we want to assess for any abnormalities in the nasal cavity, like if they're having difficulty breathing or if there's a known obstruction. Then we're going to measure the NG tube from the nose, bringing it to the earlobe all the way down to the xiphoid process. Then you want to mark this with a Sharpie or a piece of tape. This lets you know how far to insert the tube in order for it to reach the stomach. Before we insert the tube, we want to lubricate the tube 4 to 8 inches. Then you can have the patient flex the head forward and place their chin down. Now we're going to insert the tube. You want to allow the patient to take sips of water and swallow with advancement of the tube down the esophagus into the stomach. Of course, be sure they can have water and are not on NPO. Now, you want to remove the tube immediately if the patient begins to cough, show signs of respiratory depression, or if the tube doesn't advance. Now, when advancing, be sure to stop when you get to that marked area on the tube. Then we can clamp the tube and secure it with a nasal bandage. When X-ray confirms that the tube is in place, we can start using our NG tube. If you need more help with skills like this, you will love the Clinical Pocket Guide for nurses. You can find the link to this guide on my shop, Nurse in the Making. Happy studying, future nurses.